Good afternoon, Barbara.
Is that you, Damon?
Yes, ma'am.
Oh, okay. I think you recognize voices, and you're not quite sure.
Barbara, I know Levon is called in, and Lynn Atkins is down in Henderson, and that's the only folks who have checked in so far.
Okay, so is Lynn physically there, or did she call in?
She's physically sitting in Henderson.
Okay.
Is there probably isn't. This is Steve. Is there any way to turn the phone up? Probably not. It's hard to hear Barbara.
Hi, this is Leslie.
Hi, Leslie.
Hello, this is Marie Kerr joining.
I'm Marie. It's Barbara.
Hi, Barbara. Barbara, the non-meeting, I'm losing track. Is the start time 1:45?
Yeah.
Okay. I'm getting multiple appointments for some things.
This is Levon Lewis. Is there a non-meeting today?
Yeah, check your email.
Oh, okay.
Steve? Who's joining? Who's joining? Who's joining the call?
This is Dr. Jameson.
Oh, okay. Thank you. Steve, can you hear me?
Yes, I can hear you.
Okay. I think it sounds like we've got a quorum, and it is 12 noon. So let me go ahead and we'll call the meeting to order. For the board members on the line, if you remember to mute your phone unless you're speaking, it will help keep the microphones clear for both Carson City and Henderson. So I don't have any announcements other than mute the phone. There is only one item on the agenda today other than the public comment. So with that, Steve, would you take roll call to make sure that we've got a quorum?
Yes, I will do that. Thank you. Ms. Johnstone?
I'm on the phone.
Ms. Lewis?
Here, on the phone.
Dr. Jameson?
Just unmuting. Here.
Ms. Kerr?
Present on the phone.
Dr. Ford? Mr. Wilden? Commissioner Kipper? Ms. Teska,
Here in Carson City.
Ms. Atkins,
Here in Henderson.
and Ms. Campbell.
Here on the phone. All right, we have a quorum.
Yes, we do.
Yes, and so this is a publicly noticed meeting that's being teleconferenced between Carson City and Henderson. Most of the members are on the phone line today because there's only one item on the agenda. So I'm going to go ahead and start with public comment. Damon, you're up in Carson City. Can you tell me, is there anyone there for public comment?
Doesn't appear so, Madam Chair.
You? And Steve, is there anyone there? Or I guess, Lynn, you're there in Henderson, aren't you?
Yes, I'm here, and there's no public comment.
Okay, fine. Then let's move ahead then to agenda item number 3, which is the report from health claim auditors with respect to the BOSS system and Xerox. Can you tell me who is present either in Henderson or in Carson City representing Xerox if we have any questions?
I believe everyone is in Henderson, and the gentleman from Health Claim Auditors has gotten to the table, and I'll have him introduce himself. And I think we'll have him just be there by himself, and then with that.
But we do have representatives from Xerox present in Henderson as well?
Yes, we do.
Okay, so if we need them to come forward, then you can help me monitor the meeting that way. Thank you, Ms. Atkins. So if Mr. Carl come forward and then identify himself for the record. We're not hearing anything. Is his microphone on?
Yes. Madam Chair, board members, for the record, my name is William Carr, and I represent Health Claim Auditors Incorporated. We are an independent audit firm that conducts in excess of 200 audits annually since 1987. We were engaged to conduct this audit as a subcontractor to Public Consulting Group Incorporated, who is awarded this project. Should I get right into the report?
Yeah, I don't know how you want to proceed on it. We'll take your lead on it. If you want members to ask questions, why don't you pause after you get done with each section, and then we can ask any questions at that point in time.
Thank you. Health Claim Auditors was directed to conduct an audit that focused on 2 primary issues. First was to validate and deliver the metric measurements of Xerox guarantees as compared to the service level agreements, and to audit the accuracy of the files for the participants that completed the enrollment portion of the application. Due to all the reported problems being experienced by participants within the application process during the initial first months, this report was expanded to include the performance guaranteed measurements from October 2013 through February of 2014, which was the latest available at the time of the audit to disclose and measure the impact of any changes or fixes that identified defects after January 1st. The preliminary report was presented to Xerox for their review on March 24, 2014, and we received their responses on the requested deadline of April 7, 2014. All Xerox responses and comments are displayed within the report in bold print. Xerox has provided statements earlier last week that the performance guarantees are not to be enforced until enrollments are effective, as per discussion with the exchange. The request for proposal, which was number 2023, and documents provided for the audit reflect the effective date of most SLAs, service level agreements, as to go live date. We have provided the performance of all months. However, the areas within the the shaded area in the charts on page 3 of your report may or may not have penalties applied depending on the verification of Xerox statement. The first performance guarantee is for the time that Xerox system was operational. The guarantee allows for an average of 43 minutes per month downtime unless authorized by the exchange. Every month from October 2013 through February of 2014 failed, which had a range of 350% to 2,400%, and allowed downtime per month, with February showing a big improvement to 293 downtime minutes. The performance guarantee for the portal response time to the exchange was to have 100% of the incidents reported in less than 15 seconds. The average response time was at 2.1 seconds for the audited period, but failed for the months of January and February 2014, with one incident for each month which exceeded the guarantee. The resolution time for applicants was broken into the same four categories: low, medium, high, and critical priorities. Every category for every month from October 2013 through February of 2014 failed except for the high priority resolutions in January 2014 and the critical priorities in November through February, because there were no incidents within these categories. November 2013 was the best month with up to 87% of the resolution times met, still below the guarantee. However, the rest of the months reflected the majority of the categories at 0% of the guarantee metric met. The incident response time was also broken into the same four categories, where a percentage of incidents had to be responded within 1 hour or less. Xerox failed all levels in October 2013, 2 of the 4 categories in November, and it successfully passed all metric measurement levels in the category for December, January, and February. The agreement
someone joined the call. Who just joined on the line?
Barbara, it's Mike. Sorry, we were having a hard time. I hit the wrong number.
That's all right. Thank you, Mr. Wilden. If the record will reflect that Mr. Wilden has joined. Thank you, Mr. Carr. Sorry to interrupt.
No problem. The agreement stipulates that the image of incoming documents has to be available within the system within 1 day after it is scanned. Xerox passed this category for October and November, however, failed for December, January, and February. The measurement for online documentation images being available within 1 business day after scanned is based on a random sample size by Xerox. We recommend that this category be measured for 100% of documents received by Xerox. The guarantee for call center reflects that it is to be operational 24 hours per day, 7 days a week. Since the call center hours are set within the operation agreement as 8 a.m. through 8 p.m. Monday through Friday, and 9 a.m. to 3 p.m. Saturday and Sunday, the guarantee was measurement on the agreement hours. Xerox was found to be in compliance with the call center hours for every month of October through February. It is HCA's recommendation that the agreement be amended to reflect 100% of the call center function hours versus its current language. The guarantee for incoming call response time reflects that 90% of the calls must be answered within 30 seconds, 95% within 45 seconds, 99% within 60 seconds, with an aggregate average of 30 seconds for all incoming calls. Measurement of this guarantee finds that Xerox failed every category for every month. The average incoming call was best in October at 310% of the guarantee at 93 seconds, with a significant worst at 10,000% in December and 3,069 second average. Xerox hiring of 67 customer service representatives in January helped them reduce the average response time to 105 seconds. but this is still below the performance guarantee. The block call rate is to be 1% or less. Xerox passed all months except November. Block calls no longer were an issue since Xerox doubled the number of incoming lines to 184 at the end of December. The guarantee for abandoned calls by applicants is to be at 3% or less. Results of the category show that Xerox failed every month, with the best at 230% of the guarantee at 6.9%, with December and January up to 1,950% of the guarantee at a level of 59%. Due to the added customer service representatives hired by Xerox in January, February's abandonment rate reflected much improved to the level of 8.1%. The measurement of abandonment rate of 3% or less is acceptable within industry standards. However, this category is measured upon participants' completion of the interactive voiced response selections. It is HCA's recommendation that consideration be given by the exchange to measure this metric with the participant's initial telephone contact, including the IVR selection time, to accurately measure this issue. Wait time was to be at 2 minutes or less for incoming calls. Xerox failed each month from November through February, with only October passing. The wait time reached a level in excess of 3,000% of the guarantee, or in excess of 60 minutes in January. Again, due to the Xerox hiring additional CSRs, the wait time for February was significantly improved to 3 minutes. The performance categories of all response time, block calls, abandonment rate, and wait hold time are displayed within the call center performance guarantee. However, specific language for measurement and application of penalties to these important service categories is omitted. It is HCA's recommendation that each of these categories have penalties for noncompliance and stand on their own individual performance guarantee as typically measured within industry standards. In summary of a report of the performance guaranteed items, it is HCA's recommendation that penalties for each of these noncompliance items be calculated and collected by the Silver State Exchange from Xerox. We have estimated the penalties for each category within the penalties for noncompliance section of this report. However, it is important to disclose that the contract made available to us as a disclosure that states the aggregate damage for failure to meet performance criteria listed within attachment Q shall not exceed a monthly maximum of $25,000 or 5% of the administrative cost of monthly billings, whichever is greater. To audit the accuracy of the files for those participants that completed the enrollment portion of the application, 500 randomly selected claims plus 40 biasly selected claims were obtained from the detailed claims listing of all completed enrollments for the period of October 1st through December 31st, 2013. The selection included all medical categories of dental medical plans with and without advanced premium tax credits and cost-sharing reduction subsidies, tribal member applications, as well as the state of Nevada Medicaid and Children Health Insurance Program. Due to the high level of Medicaid applicants, which was in excess of 60% of the total population, we obtained authorization from the exchange to limit the audit of Medicaid claims at 25% of the total audited claims. The first issue to address is the massive amount of applications with multiple accounts that we believe is creating customer service problems, confusion, and requiring participants to repeat the same inquiries and requests. Of all the reviewed files, 23.3% were found to have 2 or as many as 10 accounts for one person, with as many as 16 reported. These multiple accounts create great difficulty in customer service operations, as the accounts are not directly linked to one another. We estimate that there is an excess of 50,000 of these duplicate and temporary accounts beyond the participant's primary account. At this time, it is our recommendation that Xerox consider linking all accounts pertinent to the same applicant for improved customer service. Of the claims audited, the results reflect 12.2% of HCA calculations of advanced premium tax credit subsidies could not be matched with Xerox applied applications. The audit detected a participant within the random selection who had an income too high to qualify for APTC subsidy that was applied to their account as reflected in our detailed report. 1.8% of the accounts were found to have applied subsidies that differ from the invoice amount reflected in the detailed claims report supplied to from Xerox. The audit detected claims that were identified by Xerox as cost share reduction eligible, but had no subsidies applied. These exceptions represented 11.3% of the reviewed claims. Applications received by Xerox that reflect individuals with an income below 138% of the federal poverty level or eligible for Medicaid or the CHIP program were forwarded to the appropriate agency. A concern detected with this issue is the lack of policy to address these applicants that were sent to Medicaid as a possible participant but denied by Medicaid. These individuals are instructed to reapply with HealthLink, where it was most probable that they would again be referred back to Medicaid without achieving successful enrollment in any plan. It was recognized that before the 1st of 2014, numerous participant applicants were delayed for up to 3 months before they were forwarded to the proper authorities to determine if Medicaid is Medicaid eligible. It was detected that 1.3% of the claims audited had a plan premium loaded on the Xerox system different than the premium shown on the Department of Insurance Health Rates website. 2.7% of the claims were found to have invoice plan premium different than that shown in the detailed claim report supplied by Xerox for the audit. The audit detected claims in which APTC was not included within the participant's invoice for January, February, and March of 2014. Further research of this issue reflects that 1,063 invoices sent to participants for their January premium payments were defective and missing their subsidy. The same number of defects within this issue remained in February and March 2014 and up to the time of this audit. Xerox has stated that April 2014 invoices would correct this issue. The audit detected claims in which participants reviewed positive tobacco use within their application and had their subsidies incorrectly applied to their invoice. Xerox stated that this situation affects invoices but will be corrected during the redetermination process. The audit included a review of validation of documents required for a potential participant to be enrolled within the exchange, which included citizenship, Social Security, immigration status, income, tribal verification, incarceration, life verification. Of the random reviewed claims, 1.4% of the participants' accounts did not contain validation or verification of any required documentation required for enrollment. 1.2% of the participant accounts did not contain complete validation or verification of documentation required for enrollment. claims were encountered in which the federal hub reflected a positive incarceration status where the applicant stated no current incarceration. In these cases, it was found that Xerox worked directly with the participant and the Nevada Division of Welfare and Supportive Services to clarify and resolve these issues. The Xerox system is designed to validate or ping on the federal hub only once for required information such as Social Security and others. If during the application process, the federal hub is not functioning at that time, the Xerox secondary process is to request a documentation for manual validation. The information is not sent back and pinged to validate through the federal hub a second time. Due that Xerox has had a very large backlog of incoming correspondence, HCA conducted a focused review on the current procedures to ensure that incoming data essential to time requirements were being attended to. At the time of this audit, Xerox was sorting incoming correspondence to be applied to participant files for completions of the enrollment status. Xerox was conducting specific searches for possible appeal requests to ensure that the exchange be in compliance with the requirements of 90 days after receipt of said notification. The resources and personnel applied by Xerox to this issue at the end of February 2014 greatly reduced the backlog, and their current method for sorting incoming correspondence has increased the confidence level of engaging priority communication in a timely manner. In reviewing the claims for accuracy, the audit detected 3 additional defects within the Xerox system that increased the difficulty in servicing applicants. 9.4% of the claims with the completed enrollment application information supplied by the participant was not transferred into the Xerox Customer Relation Management System. This information was found on the Customer Service Representative System. However, it is Xerox standard operating policy to transfer this information so it can be utilized by Xerox customer service representatives. 3.2% of the completed enrollment dependent application information was not connected to the subscriber information, and 1% of the accounts could not be found in the Xerox Customer Relationship Management System, as it was missing the subscriber's name. HCA was concerned in the direction for participants request for income within the electronic application process did not state whether gross income or modified income levels should be entered. So we conducted an experiment which one of our auditors created 2 different applications with different income amounts. In our test, both applications were accepted, one with gross income amount, the other with modified income amount, with APTC subsidy being applied to the modified income amount. The application for these single participant test accounts were completed in approximately 40 minutes each. In the situation of thousands of uncomplicated applications within HealthLink, it was found that Xerox does not send a notice to a potential participant within 90 days before the application is terminated. The audit researched but found no safeguards or systematic edit that prevents a participant from opening both a medical and dental account and canceling the medical coverage to gain dental-only coverage. Exchange staff had supplied us with applicant complaints with problem issues. Review of these files resulted that many of the problems were created by the participants for reasons of not completing the application process, insufficient funds, and or not eligible for coverage. However, the bias-selected files reviewed, 53% were found to contain one or more exception issue problems created by Xerox. Xerox conducts daily reviews of appeal requests that come in. At the time of the audit, Xerox had one valid appeal forwarded to DWSS for hearings and 4 valid appeal cases under investigation. The building security, handling, and security of sensitive data and materials, as well as the proper disposal of data, was reviewed, and there was no breaches found at the time of this audit. Madam Chair, this concludes my presentation at this time. Any questions?
Barbara, are you there?
Thank you. I had my phone on mute. Thanks. I'm going to open it up for questions with the board members to either Mr. Carr or to Xerox. And Ms. Atkins, would you help me with that? If there's a question directed to Xerox, would you get them up to the table and get them identified for the record, please?
Sure.
All right. So do we have questions from board members to Mr. Carr or to Xerox?
Barbara, this is Mike Wilden. I have one.
Yes, Mr. Wilden.
I'm having a hard time tracking and understanding. On page 22 of the report, actually it's in here several pages, but I think it's most clear on page 22 of the report that I was sent. And the question deals with the APTC calculations. And so you have a statement that says, of 540 reviewed claims, 76 or 14.1% had the APTC accurately applied. So when I read that in the inverse, it says to me 86 were inaccurately applied. Am I wrong to do that, or?
Yeah, the problem that incurred in that situation is the advanced premium tax credit subsidy was calculated based on enrollment's age minus 1 year. So we did have a difference in our calculation versus what Xerox calculation was based on that minus 1 year.
Mr. Carr, could you get a little bit closer to the mic? You fade in and out. I'm having difficulty hearing your response.
Okay, let me repeat that. You are correct. There were a difference in calculation between the advanced premium tax credit of what we calculated versus what Xerox calculated. And what caused that difference in calculation was the advanced premium tax credit subsidy calculated based on enrollment's age minus 1 year. So our calculation was different than theirs. And there was supporting references, as you can see below.
But again, I'm trying to really understand this, and I'm still not. Are we saying that in 86% of the 540 they were inaccurately calculated? Because again, your statement says that only 14% were accurately applied. So when I do the inverse, it says to me 86% were inaccurately applied. Am I not getting it, or?
I think there may be a potential typo in there that it should be 14 I will get back with you from the auditor, but I think it should be 14.1% were inappropriately applied, because I'm looking at the supporting references below, and that looks like 76 cases to me. So,
okay, because I think we want to be clear on that, because the sentence right here says 14% were accurately applied.
Yeah, it should be inaccurately applied.
Madam Chair, this is Leslie Johnstone.
Yep.
I read it as they're accurately applied, but for the wrong age. So the end result is they were wrong.
But I don't want to come away from here saying that anything. What I need to come away from is there aren't 86% inaccurately applied.
That is correct. Of the 540 cases, there were 76 cases that were inaccurately
1 year off on the age range.
Yes, because of the 1 year.
Which is the appropriate age range? 50 or 49?
In this particular case, they actually used the actual, or excuse me, if I remember correctly, they added, if it was in the middle of the year, they added one. If it was in the beginning of the year, they were accurate. So the ones that were later in the year, if I remember correctly, they added one where they actually didn't have the appropriate age.
Mr. Wilden, does that answer your question?
Yes, thank you.
Mr. Carr, with respect to the 76 that are inaccurate for APTC, do you know if that subsidy was understated or stated?
In this particular case, and reading through the report, and Bob's actually the one that set this audit up, but it says, for example, if the participant's age was reflected at 50 years of age on the detailed claims report, the calculation matched allowable for 49 years old. So it would actually be understated.
This is Lynn. So what you're saying is the ones that were inaccurately calculated, they were calculated low. That's
correct.
Okay, so when these folks go back to true up on their taxes in 2014, there's not going to be a penalty. They should, depending upon all other things, but on this one, they should be due some sort of a credit.
That is correct.
Okay.
And I will re-verify that with the auditor to make sure I'm correct on that statement.
Any other questions from board members?
This is Lynn. I have a couple of questions, and Mr. Wilden might already know the answer to this, but the Medicaid denials, the folks coming back in then, so has that issue been resolved or that issue not been resolved? So when people are denied Medicaid and when they're coming back in, I think
they go to Medicaid, they get denied.
And they're coming back. My understanding is they can't go back in and update their application. They have to start a new medication. So why is that circle? Is there something that they're going to input that says I was already denied Medicaid and therefore, can I have someone from Xerox come up and respond to that?
Lynn, while they're coming up, I would want to get on the record, I guess, what my understanding is. When Medicaid does a denial, we send a letter to the applicant saying that we're denying your Medicaid, you're not eligible, and you might want to go back to the health link and reapply. It's also my understanding that we send an electronic file back to Xerox indicating that we've denied someone's application, but lack of technical terms here, somehow they can't catch it and do something about it, and so it's dependent upon the client getting the letter and going back in to the system and reapplying.
Good afternoon. This is Greg Padiello from Xerox. Again, with the implementation of special enrollment, we will have the ability for folks not to have to go in and re-enter an application from start. There is some functionality that is scheduled to go in, I believe it's supposed to go in this evening, which will allow us to continue the processing of those individuals who were denied Medicaid and sent back to us.
Okay, and Mr. Wilden, do you have just a ballpark number of what those are, weekly or monthly, or I'm not sure how you keep track. I'm just wondering what the volume is.
Ms. Atkins, we did a special push about a month ago. Actually, I would say, in the second or third week of March, because I was worried that we wouldn't get those denials out because of the high Medicaid volume. I have an email or report that welfare identified about 1,600 obvious denials, and so we processed those, put those as a priority process, and there were, I believe, about 1,600 what we called obvious denials. There are probably more onesies and twosies, but that was the mass push in that second or third week of March that we wanted to make sure they got a denial notice so they could have an opportunity to go back in before March 31.
Thank you. So I guess my just follow-up question to Xerox is, without words like functionality and updates and this evening, people who are denied Medicaid and are told to come back to the exchange, those people are not going to get back on the Medicaid kind of track. There is a system in place that they will be seen, flagged, whatever the word is, and that they will be diverted to the qualified health plans.
That is correct.
Thank you. And I have one other question. I guess so. For all the errors that are in here that there were caught on the samples, what is Xerox in the process of addressing those particular individual cases to try and resolve those particular individual cases, or no? Does it depend upon which issue? Kind of, how is Xerox kind of using some of this information at least to fix some of the errors for particular people that we now know?
For the record, again, this is Greg Padiello. We are going through each of the cases that were identified and each of the errors that were identified. In some of these issues, we have changes were made to the system which would prevent these errors going forward. We're looking at each of the cases individually and going through to correct each of them in situations where there truly was an issue.
And one follow-up question, if I might. And there's an estimate of about 50,000 duplicate files. How long is it going to take, or is there a plan in place to merge all of these files, to flag them together, or is it kind of that's no, we're not able to do that? I mean, what's the status and the plan on that?
So we are going through the process right now of reviewing each of the duplicates where we can, as I've explained in prior meetings. You know, in the cases where we can truly identify a duplicate, and that means that we can match them based on a name, a social security number, a date of birth. We are going through and doing a cleanup of those duplicates to remove those duplicates from the system, and ensuring that we're keeping the main account that we're determining eligibility on. You know, in many cases, you know, the system is acting as designed. Because it is a shopping system, it allowed for the creation of more than, you know, one account, understanding that, you know, that was, in some cases, we were directing people to create a second account because they were previously stuck in the process.
Thank you. I'm sorry. I do have one other question, if the board chair doesn't mind. The one person, or the one file that was caught that the person had a subsidy when they don't qualify, I would think that would be kind of high priority, because that could be financially a really bad situation when the taxes come along. So for the person, whoever this is, I would strongly ask, I don't know if it's staff or Xerox or somebody, to make sure that that gets followed up with, because that could be a really bad circumstance.
Agreed, and we'll work with the exchange staff, and we will review that and provide an update on that particular individual.
Madam Chair, Mike Wilden, may I have one more follow-up along Lynn's line of questioning?
Yes, go ahead, Mr. Wilden.
I'm sorry. Under the section invoices, the report, the statement was made, and I can see it on page 25, that there are 1,063 invoices that were wrong, that APTC was not put into the invoice, and so my understanding, those people would be charged a higher premium. I don't see a comment back from Xerox in the report, so what specific action is taken to the 1,063 people who it appeared to me that would be owed back money? It says it's corrected for April, but what about January, February, and March?
So, Mr. Wilden, this is Greg Padiello again from Xerox. We have a process in place to every month go through and do a quality review of the invoices and pull any individuals who were identified as having an APTC calculation error. We are in the process of reviewing those issues and making corrections and working with the exchange to correct each of those individual cases. We fixed the APTC issues on a go-forward basis. There is some retroactivity that needs to be corrected manually in those cases to correct the situation, and we're working with the exchange to do that now.
But you have the hard list here. I mean, again, the report has a list of 1,063 names, so I assume we're working that list to get people their money back.
That is correct. We do have each of those individuals identified and are working a list.
Madam Chair, this is Leslie Johnstone.
Yes, go ahead, Leslie.
Standard procedure would be for the firm being audited to have a response to each of the findings. Why is there not a Xerox response to each of the findings?
Ms. Johnstone, this is Greg Padiello again for the record. Our understanding of how the audit was developed was based on recommendations, and they were not listed as individual findings. We would be happy to respond to each of those findings in writing.
Just for future, I would like the firm being audited to have the audit into the report itself. Can you hear me? I got a lot of feedback.
I'll try to repeat what I think I heard you say, Ms. Johnstone. You said for the future you would like our response to be embedded with the recommendations and findings inclusive at the point when the report is produced for the board to review.
Yes, and it would obviously be most helpful if the time frame for the correction is also included in the response.
We will work with the exchange and HCA in future audits. Again, this is a quarterly audit that is part of our contract to work with HCA and the exchange, and we will ensure that we do that as a go-forward measure.
All right, I'm going to ask the other board members if they have questions. Ms. Lewis, have any additional questions?
Well, my only question or comment was that we are seeing a large percentage of errors in the reviewed claims. Does Xerox have a plan for looking at all of the, insured that they presently have to ensure that they are correct and don't have some of these same problems that have been identified in the selected files? What quality
This is Greg Padiello
control
from Xerox again.
do they have in place?
Remind members.
Madam Chair, this is Lynn Atkins. I have another question, but I wanted to give the other board members an opportunity to ask before I kind of jumped in again.
Okay, but I don't think we have it.
This is Yvonne Lewis. I don't think I got a response to my question in terms of have they identified other instances of the same kinds of problems that were identified in the audit that were found in the 500 and plus files that were reviewed by the auditors? And do they have any procedure in place for looking for those kinds of things?
This is Greg Padiello for the record again. Again, many of the issues that were identified as a result of the audit, we have addressed as part of system fixes. We, again, are in the process of going through and reviewing each of these individual cases and will be looking at any other cases that might potentially be in this situation. We are tracking, we track issues as they are identified and which members are affected by those issues. And as we make those corrections to the system, we're also going through and making the appropriate corrections to anybody who's been affected that's been identified as part of that system issue.
All right, I'm going to, Kirk, do you have any questions?
No questions, thank you.
Dr. Jameson?
Sorry, on mute.
Do you have any questions, Dr. Jameson?
No, I do not have it.
And going back, Atkins, you had a few additional questions.
Yes, thank you. Just one other question. It's probably for health claim auditors. The one group I don't see that was defined here are any payments that have been received from individuals who then who then have not received their insurance card or aren't identified with a particular plan. So people that have signed up and that we've received their money, but they do not have their health insurance card, and that information has not been transferred to the carrier. Is that because of those 500, none of those were?
There was no auditing on site at the carrier's office to determine that information. So we can show the transfer of that information, and that was audited, but the on-site audit of each individual carrier would be dramatically time-consuming and was not done.
Thank you.
I have a question for Mr. Parr with respect to the plan premiums. I know the number's relatively small, but I just want to make sure that the correction has been made, that there were plans on our system that were not reflected on the Division of Insurance website. Can you address that question for me, please?
What you're talking about is, I'm sorry, you're talking about where it did not match the website?
Right. Well, if you look at the report on page 24.
24, okay.
Plan premiums were loaded on the Xerox system that were different than on the Division of Insurance website.
Yeah, and just to correct, once again, this is Bill Carr with Health Claim Auditors. Just to correct, or excuse me, to define what you're talking about is under premiums, plan premium loaded on Xerox system, different than premium shown in Department of Insurance Health Rates website. What we did is we looked at the information we were given by Xerox as the plan premium and compared it to the DOI Health Rates website. And we did have some differences, and those are supporting references of the...
Mr. Carr, you need to get closer to the microphone, please.
I'm sorry. Just to define what the area that we're discussing. Once again, it's Bill Carr with Health Claim Auditors. Plan premium loaded on Xerox system, different than premium shown on Department of Insurance Health Rates website. Just to define that, what we did is we took the information that was available to us from Xerox on the plan premium and compared it with the DOI Health Rates website, and there was a differential. There were supporting references 2, 4, 6, 7 cases out of the 500 that we showed where that happened.
Has that been corrected?
Ms. Campbell, this is Greg Vidiello for the record again. I will go back and research to ensure that each of those issues have been corrected. As I stated earlier, we're working through the report to correct each of the individual issues identified for each of these cases.
And then I have one last question, turning to page 30. on the pended claims. I think the narrative says this is a snapshot report taken on a specific day. Do you know what that date was, and what is the status of those pended claims today?
Can you define exactly where? Can you define exactly where it states that?
I'm sorry. Did you understand what I was asking?
He's just asking for a direction in the paragraph which I just showed him.
It states that, and let me read that paragraph, or where I think it starts. The measurement of this data was provided as a snapshot report. The report reflected the pending claims as they were reported on the specific day that the report was recorded. So what we're saying is the day that that report was made is that specific day.
And Ms. Campbell, this is Greg.
What is that date?
I will refer that. I can get back to you. Let me talk to the auditors and get a clear definition of that date.
And Ms. Campbell, this is Greg Vidiello from...
Go ahead,
I
Greg.
apologize. I'm sorry, Ms. Campbell. I just wanted to clarify that if you're referring to the 8,819 claims pended for non-payment, what that really means are individuals who were determined eligible, had selected a plan, and they had to make a payment in order to complete the enrollment process. And so it's very similar to the information that we've been reporting at each board meeting. And those are the individuals that we reach out to in order to let them know what their premium payment will be so they can complete the enrollment process.
And then one last question, turning to page 20 on the turnaround time. And I'm specifically talking about HCA Net, where dates were reset and some of the information there had been deleted and was irretrievable. Is that a concern to HCA?
Yes, those were direct comments from Xerox, and that is a concern because that information is not audible when it's destroyed.
Have we seen anything else where information has been deleted and we can't retrieve it?
To the best of my knowledge, that is the only case.
Xerox, do you want to respond to that?
This is Greg Vidiello for the record. Again, I'm not aware of any other issues in like this one, so I don't anticipate any further issues.
Thank you. I'll ask the board again. Any further questions from any of the board members?
Madam Chair, this is Leslie Johnstone. I just have a comment rather than a question that, it does not appear to me that Xerox is taking this report seriously and the magnitude of these errors and the number of errors. To be at this meeting and not have information pertaining to each of the issues and what the action plan is with the timelines, I think is just not responsible, and it tells me that Xerox is not taking it seriously, and they should. That's all.
Thank you, Ms. Johnstone. Any other questions or comments from board members?
Ms. Johnstone or Ms. Campbell, I don't know. Mr. Vidiello was about to speak, and I don't know if you want him to respond to Ms. Johnstone's question or comment.
Yeah, go ahead and respond if you wish.
Ms. Campbell and Ms. Johnstone, actually, we take the results of this audit very seriously based on information and feedback received from HCA and the exchange. We have been working to resolve each of the findings. We reviewed the report from the standpoint of the recommendations made by HCA. and are prepared to work with the exchange to implement any of those recommendations that the exchange wishes to move forward with. Again, we do take the whole report seriously and in no way, look at the report any differently.
All right. Well, I would like to have the follow-up from HCA and Xerox where you were going to get additional information. If you would get that back to us by Wednesday of next week, please. And if there aren't any other questions or comments from board members, I'm going to close this portion of the agenda and move on to possible action dates for future meetings. Are there any requests for agenda items in the next several weeks? Not hearing any, then I'm going to move on again to public comment. Do we have anyone in Henderson with public comment?
It does not look like there is any public comment in Henderson.
All right. Mr. Haycock, anyone in Carson City?
Does not appear so, Madam Chair.
All right. With that, I want to thank everyone for their time in attending this meeting today. And with that, we'll go ahead and adjourn. Thank you very much, everyone.